Hello everyone and welcome back to the next syllabus point of IB Psych Revision. Today we are looking at syllabus point 5.8, evaluate the use of biomedical, individual and group approaches to the treatment of major depressive disorder, more commonly known as depression. As always, we want to look at the command term before we start, and in this case it is evaluate, which means make an appraisal by weighing up strengths and limitations of something. So to make this easier, the table is divided into treatment, description of treatment, strengths, and weaknesses. We're going to go through first drug therapy. We might skip over electroconvulsive therapy, go through to cognitive therapy, and lastly to group therapy. Okay, so the first one we're starting with is drug therapy, and just important to note that drug therapy assumes that there is a biological problem, so we want to treat it biologically. And main thing that we are trying to do is to restore chemical balance, as there is assumed there is a chemical imbalance. Drugs for depression are called antidepressants, and there are three types. The first is tricyclics, second is monoamine oxidase inhibitors or MAOIs, and the third is selective serotonin reuptake inhibitors or SSRIs. Starting with tricyclics, they basically work by blocking the reuptake of serotonin and norepinephrine, which are two monoamine neurotransmitters, which increases the likelihood of bonding with the receptor site and keeping the neurotransmitters in the synapse for longer. Monoamine oxidase inhibitors prevent enzymes from deactivating all the monoamine transmitters, which, just as the tricyclics do, increases the likelihood that the chemical message will be passed on. And SSRIs are the preferred treatment or the first-line treatment for depression, and they function specifically on the monoamine neurotransmitter serotonin. And as I said, all of them function basically by increasing the likelihood that the chemical message will be passed on. So now we're going to look at the strengths of each treatment, of each drug. So the tricyclics, meta-analysis shows that they have about a 65 to 70% effectiveness rate, excluding dropouts. Including dropouts, it's about 50%, and that comes from the Depression Guideline Panel. Those were the first ever antidepressants, so naturally they weren't that good, and they improved with time. So MAOIs are more effective than tricyclics. They also have fewer side effects, but they have about the same effectiveness rate, 50%, and that continues even for the newer antidepressants. SSRIs have about a 50% effectiveness rate. Each has their own weaknesses, so tricyclics take time to have an effect, as do all of them. They also have side effects, as do all of them, and they are quite high in toxicity, which means that it can be difficult to get the right amount without poisoning the patient or not doing anything at all. So that's quite hard to manage. With MAOIs, one of the things that's quite difficult is that there are special dietary considerations, which include cheese, red wine, and beer, that can lead to serious medical complications and even death. It also interacts with common medications, even such things, I believe, as Panadol, and that too can have fatal effects. And when all these considerations are taken into account, that increases the likelihood that people will drop out or discontinue taking the medication. With SSRIs, we have the risk of suicidal preoccupation, particularly in the first few weeks that the person is taking it, and paranoid reactions. It can also trigger manic episodes in bipolar individuals, although these things are quite rare. One overall statement is that drugs usually address symptoms, but they don't necessarily constitute a cure. As I said, I think we're going to skip over electroconvulsive therapy. We cover it in other videos, but it's not very necessary to go through it now, as we already have 3 main things that we're going to be talking about. And that's all you need in an essay. Moving on to cognitive therapy. Basically, one of the most commonly used ones is Beck's cognitive therapy for depression. And as we know, Beck's theory is based around the negative triad. So depressed people usually have negative thoughts about the self, about others, and their environment. And the therapy works by identifying those negative or maladaptive thought patterns and correcting them through hypothesis testing and replacement with positive thought patterns. In terms of studies that support it, meta-analysis shows that Beck's therapy is best, and that's Dobson. And what's quite good is that it is regardless of the severity of the depression. Lastly, we're going to be talking about group therapy. So what is group therapy? Group therapy is therapy conducted with other people. And that might constitute therapy conducted with people who share similar experiences. It necessarily involves sharing, feedback, trust building. And for these reasons, there should be cohesion in the group. So members should share a demographic characteristic, and one member shouldn't be different from the others. For example, there shouldn't be 6 males and 1 female. And we also, it's quite important is that we need to consider cultural factors, because culture obviously governs how we interact with other people. And if there are unspoken hierarchies about who you can address and who you can talk to and what you can share, that really interferes with the effectiveness of the therapy. So some strengths of group therapy include the fact that it's cheaper and therefore more accessible to people, especially of lower socioeconomic status. It can also reduce feelings of isolation because you recognize that you're not alone, and that plays into emotional support. Additionally, social skills can be developed. And there's also the problem of empathy, where the therapist may not have experienced the problem themselves, but that's compensated by other people who have. So I guess you really feel like you're being listened to by someone who actually knows what you're talking about. In terms of supporting studies, McDermott states that in depression, group therapy is better than no therapy for 85% of participants. And that is supported by Tosland, who shows that in some cases group therapy is more effective than individual treatment, but in no case was individual treatment more effective than group treatment. So that's quite interesting, and a good point to include in your essay. Conversely, there are weaknesses for group therapy, and those include the issue of confidentiality. Obviously, that's harder to manage when there are more people. And that might affect how confident you feel in sharing, which obviously impacts how effective the therapy is going to be. Specifically to group therapy is the problem of attrition. So that's when people generally decline in attendance as time goes on, as they feel like other people will be there and they don't need to be there, so they don't feel the same commitment as they might in individual therapy. So obviously if you don't attend, that has a negative impact. Group dynamics can have a negative effect, and you might not necessarily know how that's going to play out before it actually does play out, so that can be quite difficult to manage. And Yalom talks about how group therapy is very difficult to evaluate because of the number of extraneous variables such as demographic, such as age, gender, culture, etc. So what it really requires is longitudinal studies, double-blind studies, and placebo controls in order to really get a good picture of the true effectiveness of group therapy. So that's it for this video. I hope that made sense. See you next time.